Have you ever been sleeping and not been able to move? Have you ever freaked out from this and felt as if your breath was shortening? Hi, my name is Drouet, and today I'm going to discuss with you about what sleep paralysis is, what to expect when going through sleep paralysis, and certain diagnoses and treatments for this very disease. Personally, I have gone through it a numerous amount of times, and it has terrified me. I felt as if it was uncommon and that people would think I'm weird if I were to talk about it or bring it up. However, after doing research, I found out that almost 65% of people go through sleep paralysis, according to sleepparalysis.org, by Rachel King, an author who did experiments with this experience. What is sleep paralysis exactly? Sleepeducation.org defines it as an experience where you're unable to move your body either when falling asleep or when waking up from sleep. Your mind is 100% awake and you are aware of your surroundings, however you have no control over your body. This experience is said to feel as if it lasts 5 or 6 minutes, but when in reality it only lasts up to a minute or less. Many people believe that sleep paralysis is caused by supernatural effects, but the sleepparalysis.org explains what the real cause is. This study was done by Professor Chris French, a British psychologist at the University of London. He explains that the brain activity will slow down as you fall asleep before speeding up again, as the sleeper enters rapid eye movement, otherwise known as REM sleep. Professor Chris French explains that REM sleep is where you experience the most vivid dreaming. When entering REM sleep, the cycle happens every 2 hours or so and repeats several times throughout the night. The brain starts to shut down the release of certain neurotransmitters in order to induce a state of paralysis. He continues to explain that the body cannot move and the sleeper will be incapable of acting out the activity of their dream life, which could possibly endanger the sleeper or others around the sleeper. In normal sleep, the paralysis ceases before the sleeper becomes consciously awake. However, at times the process can fall out of step and a person may enter a state of waking conscious and become aware of their body while the body itself is still paralyzed. In some cases, the combination of wakeful and dream consciousness can cause frightening events, convincing the sleeper of hallucinations. This is why people believe that sleep paralysis is due to supernatural causes, but instead it's just their mind playing tricks on them. Although it is said to believe that sleep paralysis is one common symptom of narcolepsy, majority of people who go through it are not narcoleptic at all. Sleepparalysis.org gives advice on how to treat sleep paralysis. The best advice it gives is to first start off by having a regular sleeping pattern. Having a dysfunctional sleep or wake cycle, it may be a mediating factor in sleep paralysis. It is also said to be believed that if you avoid sleeping on your back, it reduces the chances of sleep paralysis occurring. Following this step, you must also stay calm when going to sleep. Remembering and understanding what is happening and trying to relax and breathe normally can reduce the length and intensity of the attack. Now that I told you about what sleep paralysis is, what to expect when going through it, and advice on how to treat it, I hope you are more informed on this fascinating experience. Thank you. My name is Drouet.